we coordinate activities of all nutritional activities in the state, and from time to time invite the relevant stakeholders in this project to discuss on the way forward. And thank God, with the effort of PATFA, which have built capacity of some of these members from various line ministries, the nutritional activities has been scaled up seriously in Nasarawa State. And secondly, in all the health relatives, you will discover that in 2016, the budget was a little bit low, but in 2017, we have been able to increase their budget because of the advocacies by UNICEF, by PATFA, and some others. So we are trying our best. Thank you.
Okay, thank you very much. Mr. Mohammed, you are in the most prominent and important sector that is relevant to health, agriculture. What has been your experience?
Thank you very much, Mr. Moderator and my colleagues. Agriculture is very relevant, very important. About health issues, they said, and then also the Minister of Finance, who is supposed to finance all of these other sectors. And if these sectors are not financed, they won't be able to do very, very well, and then eventually people will not be healthy. The Minister of Labor, if people are not empowered, people are not employed with the high level of unemployment that we have, if people are not employed and they cannot pay for their healthcare services, we'll have a lot of challenges in the Ministry of Health. If we don't take care of the issue of people who are the labor, if we don't care about their health insurance and so on and so forth, we'll also face a lot of challenges. In medicine, they refer to this as basically the social determinants of health. So the importance of intersectoral collaboration cannot be overemphasized. Earlier today, I gave an example of in Nigeria, we know that the primary healthcare is basically under at the local government level. And apart from the fact that we have a good collaboration between I and the Commissioner of Local Government in my own state, we will have been faced with a lot of challenges. Lastly, I also want to add something that is very important. Collaboration at all sectors, at all levels is also very critical. PATFA, one of the sponsors of this program, last year invited me for a meeting in Kuru, Jos. Now, that meeting, we realized that they invited because of the issues in trying to improve the healthcare budget, trying to ensure that the Abuja Declaration of ensuring that 15% of our health of the budget is allocated to health. We realized something. I brought up an observation that they didn't invite enough members of the state assembly. And after that meeting, they promised that they will come to our state, Niger State, and they will help us organize a meeting of the state assembly members to educate them about issues of budget allocation and ensuring that budget reaches up to double digit, preferably 15%. They did that in Niger, took the whole 24 assembly members to Lagos, had a 3-day retreat, and because of that singular act, two things came out of they doing that. One is that our budget was increased by the state assembly. They promised that they would increase the budget to double digit, so it has been increased this year from 7% to 12%. And then secondly, so we'll give kudos to PATFA for that meeting. Then secondly, the speaker picked interest in the issue of health insurance scheme, because it never came to his head, to his mind, how if people have access to a certain pool of funds, that it will reduce this out-of-pocket expenditure. Now, because of that, right now, currently, the speaker, the program he is running for the community, is his local government, Chanchaka local government, which is Mina. He's providing free health insurance scheme for the people of Mina. And then he's also our champion for ensuring that we get a bill passed for our health insurance scheme, which we hope to do that by October. So collaboration and educating people cannot be overemphasized.
Thank you so very much. Amazing experience in Niger State. Let me come back to you, Dr. Banjo. You are in the national level. What has been your specific involvement in health sector financing over the last 3 or rather 2 years or more? Because I know this administration is just over 2 years.
Okay, thank you very much. Let me just very quickly respond to 1 or 2 comments that was made. I think the value in the conversation I was trying to lead up to was not so much as to the historicals in terms of how poor public expenditure has been. I think more so is using that data to ensure that we could have the interministerial committee, but more importantly, what we've been able to get from the interministerial committee. And I talked about two things. One was that we were able to increase between 2016 and 2017 our capital budget for health for about more than 82%. And I think that's important, right, to put on the table. I think secondly is the fact that we're better able to even understand the fund flow at the finance level so that we in health can better plan how, whether it's your procurement or how you want to engage generally. So I think there's value in that. With respect to your questions, I will look at it from a number of folds. One on primary care and some of the work that we're doing on tertiary health institutions. At the primary care level, the minister said it not once, not twice, a number of times that primary care is considered the gateway or the gatekeeper, and it believes that it is the platform upon which we should build a proper health system. For us to be able to do that, it is important that it is properly financed. And how do you do the financing? It's taking it away, it's looking at it at the entire ecosystem and asking yourself, what role, right, would your financing play? With regards to what I do, because I assist the Office of the Minister in financing, is that I'm involved in all the analytical work that would that underpin some of the healthcare revitalization program that we're doing. And specifically, also I've been involved in some of the immunization work on health financing. But I think more importantly, beyond the individual, is how are we leveraging, using all of this data to leverage more resources. And that's what we're saying, not just leveraging through government domestic resources, but also being able to showcase the need for partners to be able to contribute more. And I'll give an instance with a push for the Basic Healthcare Provision Fund, for instance. Through the data that the minister has been able to share and the vision that he has put forward, we're seeing already, right, the partners are already contributing into that fund, and I'm sure that Niger can speak to that. The goal is to have a startup phase of this program within the next 2-3 months, and then move forward from there. I'll just leave it so that others can take it.
Thank you so very much. Let me ask, particularly commissioners that are here. The commissioner for Niger, you've emphasized that every minister, every commissioner is the commissioner of health. How true is this statement when it comes to putting it to work? Because I know that, how are you going to feel if you go to an interministerial conference and then health is trying to pull 80% of the budget and agriculture just say, yes, I am also commissioner of health, so let him take. Is that what happens there? So tell me the kind of challenges you face trying to, make this happen.
Yes, thank you very much. Yes, on the right track. But before I do that, I just want to collaborate what Banji, the TA to the minister, has said relating to our fairly, I would say, very good relationship. All states in Nigeria, and I'll say especially also my own state, Niger State, have had a very good working relationship with the Ministry of Health. I don't know how it used to be in the past, but under Professor Isaac Boloronsho Adewale, the relationship has been very, very strong. The Ministry of Health has been able to, in terms of issues of help states to assess, each state in Nigeria have assessed $1.5 million. All the 36 states, what they refer to as the Save 1 Million Life Funds program for results that's been expended on the primary healthcare, at the primary healthcare level. All states have assessed that. My own state, Niger State, have also benefited from the operationalization and pilot study for the basic healthcare provision, what they refer to as basic healthcare provision fund, in trying to operationalize the National Health Act. 3 states are benefiting from this: Niger State, Osun State, and Abia State. We're going to be getting about 1.5 billion naira. We'll also pay a counterpart fund to this fund in order to also further strengthen the primary healthcare level. Through the Nigerian Center for Disease Control, we've had 2 outbreaks recently, the meningitis outbreak and Lassa fever outbreak. We had the minister come down to our state during these outbreaks. And then also Dr. Chikwe, the head of the National Center for Disease Control, also came down to give us support. They support us with drugs like ribavirin and so on and so forth. And the National Primary Healthcare Development Agency also, there is a good collaboration. Now, coming down to specifically to your question, yes, there is always, for the government, always competing demands for resources that comes to that the states have. And it's always a challenge to try and defend what should come to health, even the 15% allocation that we request from health. Because like I said, most of all these other ministries will also defend the fact that what they are doing also affects health. But more importantly, what really causes more challenge for the health sector is actually the people themselves, the people at the community. Their understanding of what is their need and what are the things that are top priority for them. I don't know for other parts of the country, but I'll give an example from my own state, Niger State. Recently, the governor of Niger State, Raja Abubakar Sani Bello, did a midterm tour where he went around all the local government after his 2 years in government. One, to see the project that he is doing, are they being done? To also further engage with the people to see what they feel about his government in 2 years, and then what are the things that are still pending that they want to be addressed. Now, 5 commissioners go with him: health, education, local government, agric, and works. Now, when we go to the community and the governor is asking them what are their challenges and what are the things that bother them more, some of the things that are in top priority for them when they start mentioning water is number 1. They mention roads, and then surprisingly, in many places that we went to within our communities, mosques. They'll talk about that they want a mosque. Most communities have started even building their own mosques, and they'll tell you that they want the governor to complete it for them. Then the issue of light. At one specific place, when the governor went to a place, he now said something. He said, in Hausa, who had rashin lafiya fa? Aren't you bothered about the issue of health? And then the community leader then they say, yes, we are bothered about the issue of health. And the governor said, but you people have not mentioned it. Then the community leader laughed and then pointed at one man there, the traditional medicine healer there. That it's a problem, but this man is taking care of some of our problems. So yes, there is that kind of challenge. So for the governor himself, when he comes down, he's looking at felt needs. These are what the people are raising up, and this is what will earn you more votes. But we know that without health, you cannot do anything. You cannot exist anywhere. And the governor said to him, "Ama in Hausa, if there is no health, you can't do anything." So yeah, there are those challenges that we face. But nevertheless, most of our colleagues are aware of the fact that health is very, very important. And in my own state, I get the support that I need from them when it comes to these kind of issues. Thank you very much.
Thank you so very much. Very wonderful experience there. Now, in Nasarawa State, Dr. Daniel, what challenges do you face, both in the past and now, in trying to push for more allocation? You shared with us in the morning how the budget you had earlier was 4%, and that when you came in, you pushed it for 10 point something or thereabouts. So, what challenges did you face in doing this, knowing very well that there are competing demands, and we keep hearing from the state that the resources are simply not there?
Thank you. There are challenges, of course, in terms of funding. But I think that just as my colleague in Niger mentioned about the collaboration interministerial, in Nasarawa State, there is an understanding, from my colleagues at the council, executive council. But just, I'll give an example, Niger guy gave an example where health was not put as a priority by the community. On the other hand, I went to a community where, as a result of communal clash, the general hospital was vandalized, was destroyed. It took us quite some time to get there, not because it was far from Lafia, but because the road was in bad shape. Getting there was an issue. When we went there, I found that the primary health center was pretty good, delivering primary care pretty efficiently. And when I came back, I said to my governor, I don't think building or repairing that general hospital is the priority. The priority is access. Because with the functional primary health care, there is a hospital which is just a few kilometers away, Nasarawa Yangon. So if we prioritize road, rather than spending another billion saying you're going to put up a hospital, that security is not there and could readily be, vandalized again, then we haven't achieved what we were trying to achieve. So there needs to be that understanding. There is competing demands, but there is an understanding of what the role of health plays, and all the ministries understand that. One of the frustrations that I noticed from the cancer, panel this day was the fact that here you saw people with such passion, especially the guy from the National Hospital who is in the radiology department. And I said to myself, this guy is doing all his best, and yet the structure, the system, does not allow. It's not his fault. It's not even the fault of the Honorable Minister of Health. But the fact that you cannot effectively put that kind of system that kind of a service in a system where your electricity is not dependable. You cannot depend on electricity. So there are certain basic infrastructural needs that are needed for the system. And we haven't mentioned this. I think we need to mention it clearly. Corruption affects every part of the system in this country. And we see that manifested also in health sector.
Thank you.
Thank you, sir.
Very much. I will stay with Nasarawa State. Your ministry is responsible for budget, right? So usually when you send the budget, in the budget process, you send out your circulars with an envelope to other ministries. And when you receive them back, what usually is your psychology in trying to allocate funds? Do you have anything for health, or you are being influenced by something else?
No, we have, when we send call circular to ministries to submit their proposals, they bring their proposals, we call them to come and defend these proposals. At the course of our discussion, there are areas that we need to increase their funding. There are areas that we feel, well, this area you have not spent any money, so it is a sign to us that maybe you don't have the capacity to spend, so we can reduce it. But essentially, we take health as a very important issue, and His Excellency has been emphasizing, he gives us a ceiling that health sector should be given a priority. So no matter what, we give priority to health sector.
Okay, thank you so very much. And very distinguished participant, will now come to you because it is not meant to be a one-way traffic. It's going to be both ways. So we'll take questions now from our esteemed participants. All right. So the person at the very back, you're number one. You're number one. Then the guy in front, you're two. You have three in white. Madam, you are number 4. I know if I don't take your own, I'm not going today. You're 5, 6. Comrade, you're 6. Any hand on this row? Okay, 7. And we are good. All right, so please, there will be no preambles, no narratives, no commentary. It's just your submission, straight to the point. Our communicate people, repertoires, kindly get your work ready, because after the response, we'll be inviting you to make your first presentation. So let's have number 1. She's at the back. And I'd like you to come to where camera will see you, ma'am. Let's be sure who is talking.
Yes. Good afternoon. My name is Chika Ofo, co-chair for Track Health. My question is simple. So much has been done in the CSO world and then with international organizations, everybody supporting, but still the coverage level is going down. Now, the Commissioner for Niger State has also told us now that he has had some support, 1.5 billion from JFF. I really want to know what he's going to use the money for. It will help us to know, and then how the CSO can also come in to track, because the organization, the coalition that I co-chair, we track funds. So really want to know what, and then the SMOL, Save 1 Million Lives, 450 million. We also want to know what the money has been used for or is going to be used for, and how as CSOs we can come together to also track that money and any other monies that have come to the states. I think
thank you
that's
very
really
much.
what I want.
Number 2. Quickly.
Thank you very much. Ralph Pepple is my name. My question goes to the rep of the Honorable Minister. We used to hear a lot of appropriation, we hear releases and what have you, but hear little about or nothing about the impact, results. So going forward, what are the mechanisms in place to actually get results of the monies, a billion? Because I know that increasing the inflow does not necessarily translate to impact or results. Then again, it saddens me when we see yesterday when the minister said only Bauchi State that we can make reference at a successful state in terms of health. What are the mechanisms in terms of going forward where other states also can see what Bauchi State is doing, to learn from, to copy from, so that there will be better results going forward?
God bless you. Number 3, please. Who is 3? Indicate. Okay.
Thank you very much. My name is Silas Spencer Ideva from Kaduna. 2 of my questions have been answered. I wanted to ask on Saving 1 Million Lives. Actually, what is the result? It's this program for results. And, well, she's talked about that. My question there is just, what is the result so far? We've not had anything about the result. And this is a program that is tagged Program for Results. So I won't spend much time on that, she said so. Then, the other question I want to ask is, I remembered yesterday when the Honorable Commissioner spoke about reallocating resources, especially for human resources for health. You know, we have so much resources of health workers in one particular area, and then you have other places where you don't even have any of them, and yet we have issues on budgeting. You've spent so much here. So what are we doing? This is an interministerial committee, and we're looking at universal health coverage. What is the plan across border from the national and probably in a way that it can influence the state level, so that this universal health coverage will be well attained? Because without adequate human resource for health, I don't think we can reach there. So what is the plan on ground?
Thank you. Number 9, right?
Good evening. My name is Jane. I represent caregivers. I work in National Hospital and I work directly with cancer patients. And our concern today, we've heard the survivors, their stories and all of that. Now we're leaving this meeting. What are we taking back? Are the machines, the radiotherapy machines, are they going to be fixed? Or will our patients still go to countries like Ghana, like Kenya to seek medical help? We would not do any good to the patients if we go back to the hospitals and tell them, okay, we were in a conference, we talked about you, and it ended there. I want the reps of the minister to give us a commitment. Are we going to fix our machines? One of the survivors gave an example of how the airport was fixed in 6 weeks. And if that is attainable, given the billions it took, it's also possible to fix at least 2 of the 6 machines that are supposed to be in the 6 geopolitical zones. Thank you very much.
Thank you very much. Number 5, just behind her. All right?
Okay, I have 2 questions, and I think I'll direct one to the representative of the minister. I would want to understand how the TSA affects the whole issue of funding. and how we can go about it to restructure it in such a way that even though we're talking of accountability, it doesn't also become a hindrance to achieving what we want to. That's on the one hand. On the second hand, when we look at the issue of funding, we see a lot of donor funding in health in the country. And this comes from the Western world, so to say. We have wealthy Nigerians. Is there any structure that looks at engaging those we can call, aside from Aliko Dangote for now, how many Nigerians who have the wherewithal are actually coming out to set up, to start doing what Bill and Melinda Gates, Aliko Dangote, and so many other donor agencies or organizations are doing for our country?
Thank you.
Thank you very much. Significantly, we have like two types of interministerial relationship, which it has to do with one, a particular ministry having a content of another ministry, like a ministry of health having a content of Ministry of Works, like they want to build a hospital. So in that, this will complement another. And also there's this relationship also in such a way that one ministry needs another ministry to finish its works before it starts. So I want to ask, and we understand over time that if this relationship is maintained and is effectively and mutually exhausted, it yields a result. But at times, there is this personal problems between the head of the ministries or head of the parastatals. That's why that ministry, such a relationship is not utilized. So I want to ask the head of our ministry seated here, what usually used to be the problem that relationship is not utilized?
Okay, thank you very much, comrade. And I think the question we have on Twitter is a lot of discussion speaks to allocation. How is budget performance? Maybe like how, allocations has been done, how have you utilized those allocations to solve the problem? So we just run from here, from the Dr. Banjo representing the... Oh, there is more. Okay, yeah, I recognize her, please.
Good afternoon once more, everyone. I'm Hawakulu Ibrahim Azuja. I work with Form 1, Federation of Muslim Women Association, as National Health Project Coordinator. I want to thank the panelists for the knowledge thrown to us this afternoon, most especially the Commissioner for Health, Niger State, and Commissioner for Agri. You have just told us that Agri is health. And also the Commissioner, Niger State, had also told us that all the ministries have link to health. Coming to that, having said that, during the cancer review this afternoon, and also on WhatsApp, I read that cancer is just like scurvy. Somebody was writing that it was like scurvy when scurvy was detected, and later found out that just vitamin C that was the cure. And the cure for cancer, or the preventive measure for cancer now, is vitamin B17. And what is this B17? You said fruits and vegetables. If Agric is health, as you have said, and to eat these vegetables and fruits, as he said, is very expensive. As an Agric Commissioner, please, how can we get this available to the grassroots, or make it affordable also, so that we could be able to eat these things in abundance to prevent this harmful disease?
Thank you very much. So over to the panel. 1 minute to respond to as many questions as you want to respond to. What our agreement is 1 minute.
Okay, thanks, moderator. I may not be able to do justice to all the questions if you do tell me to take 1 minute. So wherever I stop, then I can probably move forward. I think the first question that came to me wanted to understand, sort of like mechanisms for results with regards to the budget. The way to look at it is, recurrent versus capital. And this is not a sectoral related issue. It's national, right? And then if you look at 2017, for instance, the broad budget that goes into capital expenditure is smaller than what goes into recurrent. The implications of this, if you decide to move that around, is that a number of people would have to go from the civil service, and that's not something that we want to do at the moment. But even within the capital, the question then becomes, how do we ensure that they are properly well utilized? And I think it boils down to the budget formulation process. There's what you have at the Ministry of National Planning, which is what they consider KPIs for sectors in terms of what you want to achieve. But even within the Ministry of Health, and I'm sure that a number of us who work with us there's what we have at the national level, which is the National Strategic Health Development Plan, which allows you to set your priorities and know what specific goals and objectives you want to achieve. Drawing from that is the medium-term sector strategy, which will involve all partners, right, to help develop, from which your national annual budgets do come into play. And so if all of this is put together and well done, then it's easy to be able to track results. So I just wanted to answer on that. There's a question regarding, how are we able to allow states better understand not just what the federal is doing, but also for states to learn from each other. Recently, we developed something called the Joint Learning Network. It's a global platform that we've adapted to suit local needs. And what is essentially the Joint Learning Network does is that it's a platform where, for instance, if Niger is doing very well and there's something that Nasarawa needs to learn, then they have that platform to be able to learn from one another. Ditto for if Nasarawa is doing well and Ekiti leads to learn. And that was launched about 4 weeks ago, if I'm correct. I'm sure a number of states were very heavily involved in this. So I'd encourage you to also, I can share the website at the end of the day, but I can encourage people to participate in that. On cancer, I think that this is something that is extremely dear to the Honorable Minister's heart. He has always talked about it, particularly given that, even though he's a professor of obs and gynae, his core specialization is in oncology. And I think the way to look at it is take a step back and look at why what we've done in the past hasn't worked well. And then how do you address that so that you can move forward clearly? In 2017, we have a budget of about 9 billion, focusing on ensuring that we improve existing institutions within Nigeria, but with a core focus on oncology. Well, if you look at 9 billion, it looks like huge amounts of money, but that's just $30 million. It's not going to do much, right? In reality, if you really want to build or if you want to put together suitable centers to be able to address the needs of Nigerians. And so what the minister has done is engaging with the Nigerian Sovereign Investment Authority, the NSIA, which is the Sovereign Wealth Fund in Nigeria, is how do we, pool additional resources. The NSIA is also going to put in resources into this. So we're mobilizing private sector resources. The goal is to ensure that we bring in also private sector expertise to be able to administer and run this institutions, even within existing ones. But more importantly is, making sure that the costs, for delivery for each patient in whatever form of a service that is rendered is good enough that would be able to address, that's not over the top. So it may look as if it is slower than we would have loved it to, but in reality there's something on ground, and the goal is to ensure that we move forward and be able to ensure that everyone in Nigeria who needs to have care for cancer can get it inside the country. The role of TSA and funding. I think that the way to look at TSA is that, generally speaking, TSA just gives you a good grasp of all the monies that come in. So it's just a window for everybody to be able to see what comes in and what goes out. So in the past, whereas you'd have maybe a ministry or a department or an agency, that particularly those who generate revenue, keep their revenue, and government doesn't have a good overview of what obtains. What the TSA does now, right, is that it gives the Office of the Accountant General, it gives the CBN a good grasp of how much comes in from everywhere it's coming in. And the way it has now been put together is it has less implications on how ministries are able to draw down. The government, if CBN pays or the Office of the Accountant General pays into a ministry's account, based on what the ministry wants to do, right, the ministry can draw down from that. Is another thing, whatever the appropriation is, another thing for it to have been released, another thing, another issue for it to be utilized. The big problem is not necessarily in utilization, is the gap is always between appropriation and release. And the challenge again there is not central to health. It is the reality on ground, which is that, you know, there are fiscal constraints in Nigeria, and government would have to prioritize its expenditure based on whatever is available. Thank you.
Thank you very much, Dr. Daniel, please.
I'll just speak on a few that have not been touched already by the Honorable Minister. And the first one is the issue of how we're doing with funding. Because a lot of emphasis has been placed on not adequate funding, but I think it's important that whatever we get, no matter how small, is how are we using it. And that's the role of the CSO in terms of tracking. Earlier when it was mentioned that maybe some of us are not open, you know, to that kind of holding us accountable. It's not whether it's not, you know, the question of we like it or we don't like it. We have a responsibility to the people, and it is right for the CSOs to insist on knowing what is going on, and tracking needs to be done. The issue of SOML, for example, that was raised, it's going to be like the PBF, performance, you know, based financing. I did mention, I think yesterday, that Nasarawa State is one of the states that has some experience in terms of performance-based financing, because the emphasis is on indicators. There are measurable indicators, even at the facility level in primary health care. Number of attendants, immunization, your drug stock out, and all of that. And there are verifiers which are different from us, from the Ministry of Health. Independent verifiers who go and check these things and give a report. And in fact, if you're doing well, you will get more money in terms of investing into the facilities. So that is on ground, and that's what SOML is going to do as well. The 71 million lives. So there is in place, and I think I would encourage the CSOs to do the tracking themselves and also compare it with the reports that that come from the verifiers. The issue of human resource for health, we talked about it as well. This is again where there's need to have an interministerial as well as federal ministry and the state ministries of health. I did give an example of where you have concentration of doctors in Federal Medical Center, KEFI, whereas our general hospitals are staffed of doctors. One of the reasons was because the CONMES was not fully implemented. It is now fully implemented. But all the same, there is need for a close review. I mean, you cannot insist that a person must go to where he doesn't want to go. There are ways in which you can motivate people to go to these places. So the issue of the screwed distribution of manpower is very relevant. And lastly, the issue that was raised by Musa, I believe, in terms of personality issues. This is a reality, not only interministerial, but even within the ministry. And my take on this is that we do not have a common goal or common objective. Most of it is because I'm thinking of myself, what is in there for me, rather than what is of common good to the community. It's not my interest. What is uppermost is what goes to the community and why we are where we are. We are in hospitals because of the patients. We are in positions of authority because it's a trust. We are there to discharge it. And unless we see it in that context, self is removed, and the common good is the thing to look at, that kind of problem will persist.
Thank you very much. We just have few, they have really answered extensively, so just few remarks so that we can move on to...
What I want to say is that the representative of the Honorable Minister have answered that about budget performance. In our ministry, we have a Department of Monitoring and Evaluation, which after giving out the budget, at the end of the year, we track the performance of the budget and submit the report to His Excellency to know whether he has concentrated his performance in one sector or the other. That will serve as a guide for him to know that all sectors are very relevant. It's not only one sector. So we advise it
Thank you
based
very
on
much.
budget performance.
Yeah,
Thank you.
Commissioner of Agriculture. He has the mic.
Thank you very much once again. The question that Haja asked is very apt, very important. I think agriculture, like I've mentioned, is very critical for health. And the issue she raised about cancer, about vitamins, and so on and so forth are also very relevant. This brings me to the importance of dieting. You have to take the correct food, to be able to be healthy. Most of the health challenges that we're having, or our people are experiencing, sometimes are coming from food poisoning and so on and so forth. Where the food are not properly processed, you have issues, and then sometimes taking the wrong things, you have issues, and then of course if people do not have access to good food, it also creates issues. And I was speaking to my colleague yesterday, and he told me that for 2 years he's been taking drugs because of a certain ailment that was worrying him. He's been diagnosed with whatever, and he's been taking drugs, and he keeps getting sick. Because sometimes what I have noticed with most of our people is that you get to a certain age, somewhere between 40-something and 50. And doctors, sorry, with all due apologies without any prejudice, they consign you to taking drugs for life, and then you'll be taking drugs and so on and so on and so forth. And he's been taking drugs, as he has told me, for 2 years, and it has affected his system. Only for him to realize, he said for 2 years he couldn't even look properly at his wife. She was just like another man. And by the time he decided to do some dieting, to take some supplements, and discard drugs, he noticed that he was getting better. And when the session for cancer was being on, a lot of people mentioned wrong diagnosis, probably because of the challenge that we have. We don't have the correct chemicals and the correct, whatever to do the tests, and we have issues. And so dieting is very essential. You need to take the correct food, correct cereals, the correct milk, and so on and so forth, from childhood to adulthood. And then you get a healthy nation. And then let me make a small contribution in terms of financing. It's important that the health sector gets financing. It is important that all sectors get good finance. It is also very important when you have things budgeted, they should be corresponding release, although it has to do with whether you're performing what you're performing. But I think what is essential is that the finance that has been allocated should be put to proper use, so that you will have sufficient equipments and all the things that you need to be able to put them into use. And to ensure also, for example, if you are giving health money, and like somebody mentioned during the cancer session, that you're spending almost 50% of that money to buy diesel, it means you are not getting value for the money that has been budgeted for health. So some of these things I think need to be considered, and then we will find a way forward. Thank you.
Okay, thank you very much, Dr. Mustafa.
Thank you very much. A lot of the questions have been answered. I'll just try and see if I can be a bit more specific with the remaining ones. Someone asked a question regarding the issue of the Basic Healthcare Provision Fund, the 1.5 billion that I said states would have access to. Yes, like somebody said earlier today, I think the executive director of my Niger State Development Agency advised that the CSOs should follow the money. But before you start jumping to follow the money has not yet hit our account. We hope it will hit very soon. That's because of the federal government is putting in place a lot of financial regulations to ensure that this time around these funds is utilized, so that we will be able to demonstrate results, like the person who said he wants to see results. What we are trying to adapt is what is taking place in Nasarawa State, Adamawa State, I think, and Ondo State, what they refer to as the NSHIP. That's the Nigerian States Health Investment Program, being supported by the World Bank. In this program, funds are sent directly to the facilities, and based on how these funds are utilized, more will be sent to them. It's a performance-based financing mechanism, and the pilot that has been done in shown that we get more results. Now, through this mechanism, where there are a lot of middlemen, I'll call them like that, and job issues of HMOs, issues of even the ministry itself, because sometimes you realize that when funds are released, by the time it passes through so many channels, the administrative issues, when it passes through the Ministry of Health, we cut our own, it goes through the agency, they cut their own, it goes through HMOs, they cut their own. By the time it gets to the facility, there is nothing much left. So the process that is put in place by the federal government, and I was discussing that with Banji, who is the one in charge actually of this project for the through the ministry, for the minister. I was discussing with him why we've not yet kicked off, and he said that all the paperwork to ensure that every penny that is spent is accounted for, is being put in place. We've had a meeting in Ondo, in Osun State. We've had another meeting also in Abia State. The final state is for them to come to Niger for this to be implemented. So I want to assure you that by God's grace, these funds are going to be utilized in a very, very strict manner in order to demonstrate results. Because the 3 states that have been selected are supposed to be the states. It's like a father who has 37 children, as the Minister of Health tells us. And now 3 states have been selected to feed that state. Now, depending on how we utilize that fund will determine whether other states will also benefit from the same thing. So we are used as not just as a normal pilot, but a pilot that must demonstrate results, and I'm sure you will do that. The Save 1 Million Life program for results funds is meant also, is also making use of the performance-based financing and mechanism, such that the funds that have been given, the $1.5 million, is about 400 million naira, is meant to just augment what the state is already doing at the primary health care level, and is meant to be used in malaria, maternal-to-child transmission of HIV/AIDS, maternal health, nutrition, to improve child health and immunization. At our state level so far, we've used the funds to also improve our MNCH week through increasing availability and access to vitamin A in order to improve the child health. We are recruiting midwives because of we need skilled birth attendants in each of our facilities, and then all the facilities, the one facility per ward that have been identified. So we have 274 health facilities have been given the basic equipment that they need, because there's going to be a qualitative assessment to these funds. Training of healthcare workers and tax shifting policy that my other colleague talks about is also ongoing, and integrated supported supervisions. And these are some of the things that these funds is being used for. Lastly, let me just talk about the issue of the healthcare workers. It's important. A lot of people complain that we don't have enough healthcare workers. It's very difficult for states, especially now that Nigeria is in recession. Our state and many other states have been recruiting healthcare workers, but healthcare workers are the most difficult set of workers to recruit because of their salary. Their salary is usually very, very high. So in general, overall, lastly, I would say that if a nation does not grow or develop very well, if a nation is not earning enough resources, some of the things that we want to see, sophisticated things that we want to see, like cancer care, like stopping medical tourism, being able to retain our health workforce so that they will not go outside and receive better salaries, will not happen. Somebody yesterday said that the head of the National Agency for the Control of AIDS, NACA, said yesterday that the budget of England, the health care budget of England alone, is almost 5 times the whole budget of Nigeria. England is also a country of about, I think, 60 million persons. We have about 200 million people. Their health budget alone is more than all that we are able to raise. So if our nation is not able to develop our economy, diversify our economy, raise enough resources, we won't be able to hire healthcare workers, we won't be able to retain them, we won't be able to pay them, and the kind of facilities and things that we want to see, we want to procure for cancer machine, light, and so forth, we will not be able to have those kind of things. That we are having a lot of it is going to corruption. So the economy is extremely, extremely important in order to catch up with the developing countries. So the developed countries.
Thank you very much. Please, applause for our. Please clap for for them. They have done very well. Right now, please, you remain seated because we are rounding off shortly, so you will just have the privilege of remaining here. Eh? Thank you very much. Yes, because all of you are stakeholders and you are the true owners of this dialogue. Let us now invite our rapporteurs and to present the communique, and the rule will be after she presents the communique, we will now have observations from those who participated yesterday and today on what you think they didn't capture well or what you think they should add, and that 1, 2, or 3, 4 people will make that observation. Then the House will move to adopt the communique as amended so that they will go and make the correction and then start a circulation. So we will not wait for another round of reading corrected version. Is this a deal? Let's now join hands together and make welcome Ms. Yai Bete W., who will present the communique of the outcome of this particular National Health Dialogue 2017. Please put your hands together for her.
Good evening, everyone. I'll be presenting the National Health Dialogue communique. Sorry? Okay, sorry. I'm so sure. Okay, sorry. Okay, so beginning with the introduction, it says the first National Health Dialogue was organized by Premium Times Center for Investigative Journalism, Project Pink Blue, Premium Times, PACFAR, and supported by the Bill and Melinda Gates Foundation. It was a 2-day meeting that occurred on the 24th of August and 25th of August 2017 at the Musa Yaradua Center in Abuja. The overview. The National Health Dialogue was organized for policymakers, patients, state ministries, development partners, community leaders, and CSOs, NGOs to engage in discussions on the challenges and prospects of universal health coverage in Nigeria. It started off with a welcome address and continued with goodwill messages delivered by representatives of the Bill and Melinda Gates Foundation, Premium Times Center for Investigative Journalism, PACFAR, and Project Pink Blue. The Emir of Kano, His Royal Highness Mohammed Sanusi II, heavily represented by Umar Balai, in his keynote speech, emphasized that the government should recognize and work with the traditional and religious rulers to create awareness to the uneducated about the primary health care. The opening session ended with a special remark by the Minister of Health, Professor Isaac Adewale, who stated that more money is needed for the rehabilitation of existing health infrastructures for primary health care to be available and accessible to all. After the presentations and panel discussions on the barriers to actualizing universal health coverage, lessons from the PACFAR, Project Advocacy, and action plans towards the improvement of cancer survivorship, the participants recommended that 1. Stakeholders should conduct constant dialogue to harmonize their positions as health advocates so that the health sector can move forward. 2. Mental health treatment and provisions for persons with disabilities should be included in the services covered in the National Health Insurance Scheme. 3. Establish laws that are contradictory to new bills raised towards the achievement of a universal healthcare system should be repealed. 4. With the recognition of the cultural and religious challenges, family planning advocates should be concerned with child spacing and the health of the mothers and babies rather than population explosion. 5. Mandatory contributions such as taxation should be considered as an alternative for getting the necessary funds for proper health care in states and for the agencies. 6. CSOs should develop and review policies with consideration of the dynamism of our political scene. Sorry about that. 6, 8, 7. Strategies such as tax shifting, LGA recruitment, and undertakings should be implemented to address skilled distribution of health workers. 8. There is a need to engage and educate community members so that they can hold their leaders accountable. 9. The appropriation of funds in the national health budget for there should be an appropriation of funds in the national health budget for cancer care and treatment. Thank you.
Those at the back, are you clap for Ms. Bethel? Those at the back. Thank you very much. I will just take one or two observations. And also, I've been told that this will be sent to our emails for us to make personal contribution or input into the communique on or before the close of business on Tuesday. And that all those inputs will now be finalized into the final communique that will go out. So let's have just 2 inputs because you still have opportunity to make input. So I'll take you, Madam, 1, and Doc, 2.
Good afternoon, everybody. I made mention in the morning of one of the leading diseases that is attracting medical tourism. Permit me to call it the big brother of cancer. That is kidney failure. I use the word end-stage renal disease. Maybe a lot of people did not understand me. So nothing is mentioned.
Okay, so.
And then the second one, another group of vulnerable people are the aged, geriatrics. Nothing is mentioned about them. What plans do we have for them in our country? Thank you.
And I know Comrade was raising his hands because he didn't mention the issue of people with people that are physically challenged, right?